Okay, I'm going to show a couple of quick taping techniques here, one for the elbow and one for the wrist. Generally this works well for people who have at the elbow pain with either flexing or extending their elbow, flexing or extending their elbow, or with certain hand motions like maybe gripping. So a good test to do beforehand is to have them do the painful motion. Go ahead and grip there. And then I'm going to just kind of press inward with the upper hand, and I'm pressing this way with the upper hand and this way with the lower hand. Okay, then have them grip again. And if that reduces their pain they have with whatever painful motion it was, then you're going to tape in that direction. If that is not comfortable, if that didn't increase their comfort, then you go in the opposite direction, pushing inward or pushing outward with the upper hand, inward with the lower hand, like so. Have them reattempt the motion, and if that helps, then you try to recreate that motion with the tape. So, taping looks like this. This is just a base layer. Have you straighten your arm out there for me just a little bit. Good. Okay, you don't need to apply any tension there, just lay it down, try to avoid wrinkles. Okay. Then this is going to be the top layer of tape. Generally I use either Leuco tape or this is an Endura taping, but so long as it's tough enough, adhesive enough to stick to the base layer, it should be fine. So I'm taping in this direction, but it's the same principle if you go the other way. So the idea is basically you're just going to pull the skin from this point to this point. You're trying to create wrinkles in the tape. Just like so. And then you'd have them retry their whatever motion was painful to begin with, might be wrist extension, flexion, or elbow motions, and then if you've gotten the effect you're looking for, it should feel better, even if it's only a small degree better. So for the wrist, it's the same concept. You have them start off with whatever motion is uncomfortable, and then you're going to give a little bit of pressure going inward this way or outward this way. Have them retry the motion. Go ahead and try bending up your wrist. Okay, good. Hopefully you'll see a change. If not, you try the opposite direction, like that, or with gripping. Okay, and then you tape in that direction. Let me have you turn your hand over there, please. Okay, so generally when a cross midline, it's going to be a diagonal one. So I'm gonna go in this direction, but again, if it's the other way, like this, then the tape would go from here to here. So you set your base layer. Get one small strip of the top tape. Start at one end. Pull towards the other, trying to create wrinkles in the skin. Just like that, and then have them recreate their motion, and hopefully you've seen some improvement. So kind of did it quickly here, but the big issue is with the tape sticking. Really try to make sure that you get the tape all the way down. I tell people to check for skin irritation. It's fine to wear it in the shower. That's the best place to try to take it off when you're ready to take it off. When you do take it off, do so slowly, because this stuff gets tacked down pretty good over time. So those are some taping ideas for the elbow and the wrist.